This is the Omotunde Ajoke Coal Center, situated on Lagos Island, right next to Lagos Island General Hospital. This is a smart surgical hospital. As you know, we're moving away from surgical interventions where we put you on a theater table and we cut you open and open you up and do the things we want to do as surgeons. What we're using now is telescopic surgery or keyhole surgery. And so this is a keyhole surgery facility where we'll be specializing in putting telescopes into your body through tiny incisions to do the same thing as cutting you up as we used to do in the olden days. Thank you. So it's going to be commissioned in the next few weeks. It has been completed, equipped, and they're going to start services. These are the kinds of facilities that are attracting the attention of our doctors abroad. But we have an alternative strategy. It's called brain gain. And these are the kinds of facilities that will activate brain gain. In the last 3 months, we've received nothing less than 200 inquiries of Nigerian doctors working in the UK and in America wanting to come home to practice in this facility. We're not so concerned about brain drain. It is obviously an issue, but it is better to focus on brain gain and complete the cycle. Let our doctors go out and gain specialist skills, but create the opportunity for them to come home and practice those specialist skills. And so brain gain is one of our strategies, and this is the first of our strategies to take off in the next few weeks.
If you ask many of Nigerians about their understanding of medical tourism, they'll simply say medical tourism is all about traveling overseas for medical tourism. They don't even know that there's what we call intrabound medical tourism, which is also known as domestic medical tourism, that has to do with traveling within the country in the quest for quality medical treatment. Intrabound medical tourism simply means traveling within the country in the quest for quality medical treatment, maybe from one local government to another or from one state to another within the country. And there are a lot of good hospitals in Nigeria. There we have high-profile doctors in Nigeria, good doctors in Nigeria. And one funniest thing about health sectors in Nigeria is that our medical personnel and hospitals, they're not allowed to promote themselves. You may have good hospitals or good doctors close to your house, behind your house. You may not know because it's against the ethics for a medical personnel to promote his or herself or his center to come out that, okay, I have the center, I have this center, and I'm doing this, I'm doing that. But foreign medical tourism facilitators, they come to Nigeria, foreign healthcare service providers come to Nigeria to promote themselves. But Nigeria cannot come out and promote. What is our problem? India, that people are traveling today. There was a time that citizens of India travel abroad for medical treatments. But now you see that citizens of Indians, they receive treatment in their home country, they don't go out. And there's one thing I want you to know in this business. There are driving factors for medical tourism, and there are 7. The driving factors for medical tourism are 1, availability of treatment, 2, accessibility of treatment, then affordability of treatment. Now let me start by explaining from availability. What do I mean by availability? Where patient is residing, if there is no center that can provide solution to the health challenge of the patient cannot stay and die. He or she has to go to where the treatment is available to go and get it. For example, we have a woman that has breast cancer, maybe is staying in Lekki, and there's no center in Lekki that can cure the health challenge. The patient cannot stay there and die. If the treatment if he can get the treatment in Ojota or Aja or any of he or she can go there. Now, we are talking of cost of treatment, which is affordability. Even though the treatment is available and the cost of treatment is high, the patient has to go to where the treatment is available and affordable to go and get. Then accessibility of treatment. Even though the treatment is available, is affordable and is not accessible, I'm talking of waiting time, the procedure to get the treatment done. So if the procedure will take a long period of time, the patient has money, he can go to where the treatment is available affordable and accessible. At times, some patients don't even look at the cost. They have their money to spend. So is the treatment available and is it accessible? If it's accessible, they don't even mind the cost. They go to where the treatment is available, accessible to go and get it. Then we're talking of acceptability of treatment. There are some countries or some places that particular treatment is banned. For example, go to some country, organ transplant is not allowed to be done. Then we are talking of trust. The trust is one of the important things is what we are even lacking in Nigeria. Many of our medical personnel, when they have chronic diseases, especially high profile, they travel abroad for medical treatment because the trust is not there. And because of that trust, many of our high profile, many of our top government officials, they don't want to receive treatment here because of the trust. Especially our politicians. They even think that their opponent can even use some of our medical personnel against them. Now we're talking of attitude of some of our medical personnel towards patients. There's nothing to write home about. If you go to some center in Nigeria, the way some of the healthcare service providers treat their patient is unfair, is uncalled for, and there's nothing to write home about. That alone can even make people to go to where they'll treat them with respect because they have their money to spend for their health.